MPOX screenings have been introduced in airports worldwide, including the United States. This coming out in the last 24 hours. MPOX screening introduced at airports worldwide amid rising concerns over global health security. Now, I'm going to get you caught up on the latest information rolling out and take a look at the headlines. Spain on high alert as major airports to enforce controls to stop MPOX spread as experts warn of an explosion of cases. Istanbul airport monitoring passengers from 12 African countries for symptoms of MPOX. Singapore steps up MPOX precautionary measures, temperature and visual screenings at airport and sea checkpoints as well. And this comes as we just heard recently on Thursday, Thailand has confirmed Asia's first known case of the deadlier MPOX variant. They are saying that this is going to be spreading. And just to clarify, this is not the same variant we saw in 2022. This is the 1B or even the 1A version that can be spread by any form of touch. And they're saying is significantly more deadly. And we actually saw the first case outside of the continent of Africa about a week ago when Sweden had confirmed the first case of the new MPOX variant. And a lot of people are wondering, this new global health emergency, how is this going to be affecting the United States? Will this cause lockdowns like we saw with COVID before? Experts are currently saying no, but it seems like every day there's a new development with this MPOX spread. I'm going to get you caught up on the latest. In addition to that, speaking of lockdowns, we're actually hearing there are several cities in one state that are having voluntary lockdowns right now to stop the spread of a disease that they're saying there is no cure, no vaccine, could be very deadly, and could have lifelong side effects for those that catch this. Now, this is actually also spread by mosquitoes. Now, I'm going to get you some more information on this totally separate disease that has been coming out that we're hearing more about. Stick around to the end for an update on that as well. Now, before we dive in, do me a favor, if you appreciate the updates, don't forget, take a quick second, hit the like button, even though I know this is not what anybody wants to hear. If you appreciate the updates, take a quick second, helps spread this out further so more people get the information. Also, to stay up to date, it's totally free. Why not hit the subscribe button, turn on that notification bell, and all these articles that I'm going to be referencing are going to be linked in the description below so you can see them for yourself along with additional resources for you and your family. But with that being said, let's go ahead and dive right in and get you caught up on the latest with MPOX screenings being introduced in airports worldwide. All right, so link in the description below to this article that just came out yesterday, and we're going to scroll down to where it says introduction of MPOX screening at airports. Countries around the world, particularly those with high volumes of international travelers, they have started to introduce MPOX screening measures at their airports. These measures vary from country to country, but generally include temperature checks, health questionnaires, and visual inspections for rash or other symptoms associated with the MPOX. Now, in the United States, the Center for Disease and Control Prevention, or the CDC, has partnered with the Department of Homeland Security to implement monkeypox screening at several major airports, including JFK International Airport in New York, Los Angeles International Airport, and the Hartsfield-Jackson Atlanta International Airport as well. Passengers arriving from regions where MPOX is known to be an endemic or where recent MPOX outbreaks have occurred are subject to screening before they are allowed to enter the country. In the UK, health authorities have also stepped up MPOX surveillance at airports. Heathrow Airport, one of the busiest international hubs in the world, has introduced enhanced screening procedures, including thermal imaging cameras to detect travelers with elevated body temperature and health declaration forms that passengers must complete before arrival. These measures are designed to identify potential cases early and reduce the risk of MPOX spreading within the country. India, a key global travel destination with extensive international air traffic, has implemented similar screening protocols at its primary international gateways, including the Indira Gandhi International Airport in Delhi and another international airport in Mumbai. India authorities have set up dedicated screening stations where travelers from affected regions are checked for symptoms, including skin rashes, fever, and swollen lymph nodes. Passengers who display symptoms are immediately isolated and tested, and their travel history is closely examined to determine the potential source of the infection. Now, while the introduction of the MPOX screening at airports is a significant step towards preventing international spread of the virus, it is not without challenges. One of the primary difficulties lies in the incubation period of MPOX, which can last anywhere from 5 to 21 days. This means that an infected individual may not show symptoms immediately upon arrival, making it difficult to detect cases through screening alone. Moreover, the symptoms of MPOX, particularly in its early stages, can be similar to those of the common illness, such as the influenza or COVID-19. This overlap can lead to a false positive or, conversely, missed cases if the symptoms are mild and atypical. Health authorities must therefore rely on a combination of screening methods, including detailed travel histories and laboratory testing, to accurately identify cases. There is also the challenge of managing the logistics of screening larger numbers of passengers without causing significant delays or disruptions to airport operations. Airports are already under strain as they recover from the impacts of the COVID-19 pandemic, and the additional burden of MPOX screening could exacerbate these challenges. To mitigate this, some airports have introduced automatic systems such as contactless temperature checks and digital health declarations to streamline the screening process and to reduce the need for direct interaction. Now, how will this directly impact the United States? Well, is there MPOX in the U.S. right now? The Clade 2 variant that came out back in 2022 is circulating in the United States at low levels, experts have noted. It's down to single digits or maybe even dozens of cases a month, we've heard. There are no known cases of MPOX Clade 1 or 1b in the United States at this time. The risk to the general public of the United States for Clade 1 MPOX circulating in the DRC is very low, the U.S. Department of Health and Human Services said in a news release on August 14th. Experts agree that while it is possible for a person to become infected with the Clade 1 MPOX in a country where it's spreading and travel to the United States, the chances of this happening are very slim. In a health alert issued on August 7th, the CDC stated that the risk of Clade 1 MPOX importation to the United States was very low due to the limited number of travelers and lack of direct commercial flights from the DRC and its neighboring countries to the U.S. If Clade 1 MPOX is imported, we expect that it would cause lower morbidity or mortality in the United States than in the DRC. It's unlikely that we would see a major outbreak in the United States, they added, that the MPOX is not airborne or spread as easily as respiratory viruses. It just doesn't seem very probable because of the type of close contact that is required. Now, will MPOX cause more lockdowns? When asked about the potential for MPOX lockdowns, there would be absolutely no reason to take this kind of measure, they said. However, we are seeing restrictions and screenings taking place in airports around the world. Answering the same question, the answer is no. MPOX is not new, like COVID. This is a known virus with tools already available to be able to control it, including vaccines. We've already brought a global outbreak of MPOX under control from 2022. However, as I mentioned, we are hearing that there are lockdowns taking place in the United States as northeastern towns have issued voluntary lockdowns to prevent the spread of a potentially deadly mosquito-borne disease known as EEE. And they are saying that there is no cure, no vaccines, and they are very concerned about the spread of this disease that could be fatal and also could have lifelong side effects. Now, I covered all the details on this in a recent video. To get more on it, be sure to check out this video right here next, as I covered it for you and got you all the latest information directly from the CDC as to what is unfolding in the northeastern part of the United States right now. But that is the latest, you guys. As more comes out, I'll be sure to share and keep you up to date on everything. Thank you so much for joining me, and I'll catch you in the next one. Take care. God bless. This is Steve.